All right, so in this video, I'm going to be going over the prescription rating portion of the virtual OSCE. And these types of questions are really important because they're often worth multiple marks. And so to ensure that we get each and every one of these marks, it's important that we accurately fill the prescription. So the components of the prescription are labeled as follows. So first is the drug. So what is the name of the drug that you're prescribing? So this is the most important part. As well, you'll have the strength or the dose of the drug. And so this refers to the potency or the concentration of whatever medication you're prescribing. For instance, it could be in different units or it could be in different volumes, depending on what formulation the drug is prescribed in. As well, there is the quantity. So we have the strength. The quantity is the amount of the drug that is dispensed by the pharmacist. And so you're specifying, for example, how many tablets you're going to prescribe or what volume of medication you're prescribing. The fourth component is the instructions. And so these are clear, specific guidelines that you're giving the patient on how to take the drug safely and effectively. And so you'll be giving detailed instructions on how to do so in terms of how many tablets or how much volume the patient is going to get of the medication and how often. As well, there is also repeats, and so this section indicates whether or not the patient is permitted to refill the prescription and how many times. And so each one of these components are really important in ensuring that the prescription is accurate and safe for the patient, as well as effective for whatever treatment that you're rendering. So this is what the format of the prescription is going to look like. And so the components in bold are going to be the ones that you're going to be filling out as part of the virtual OSCE. And so here we see the medication, so the drug. So this is the name and type of medication. We also see the strength, the potency per unit of the medication that is prescribed. Dispense is the total units that are prescribed. And so how many units of a specific drug you're going to be giving in this prescription. So how many tablets, how much volume, for example. SIG. So SIG indicates the instructions that you're giving the patient as to how they're going to take this drug safely and effectively. And repeat is the refill permission and limit that you're giving the patient. So sometimes there are medications in which you'll be able to give the patient the authorization to refill the prescription on an as-needed basis, and so you'll specify that over here. And the other components of the prescription, including the name, the address, signature, license number, etc., date, those are all going to be filled out for you. And so just focus on the parts in bold. So let's go over one example right here. So this is a case where this would be an accurate representation of a question you would see on the exam for the virtual OSCE for prescription rating. So in this case, we have a 67-year-old male whose chief complaint is that his tooth has a big hole in it. This tooth has been causing him ongoing pain for months, and he doesn't receive routine dental care. Medically, he has hypertension, type 2 diabetes, a cardiac prosthetic valve, and osteoarthritis. So the cardiac prosthetic valve is going to be very important because this is an indication for antibiotic prophylaxis. And so we're going to want to memorize all the indications for providing antibiotic prophylaxis, and cardiac prosthetic valve is one of them. So on the clinical exam, it appears that this tooth 4-5 is planned for extraction because it is non-restorable. And so before we do the extraction, we're going to want to provide some sort of antibiotic prophylaxis to this patient. And so over here, I've listed the table for antibiotic prophylaxis, and this is according to the American Heart Association guidelines. And so because we are not told that this patient cannot take any oral medication, we're going to go with the default. So this is the default antibiotic prophylaxis we're giving. So he's not unable to take oral medication, he's not allergic to penicillin, or it's not specified. And this last scenario is not accurate either. So oral medication, the default is going to be amoxicillin 2 grams. And so we're going to start filling out our prescription. And so the next step we're going to be prescribing is what drug we're specifying. And so this is going to be amoxicillin. And amoxicillin comes in 500 milligram tablets by default. And so we're going to want to specify that. Dispense. So because we want 2 grams, we're going to say on the prescription we want to dispense 4 tablets because 4 times 500 equals 2 grams. And we're going to tell the patient to take this 30 to 60 minutes before the dental procedure. So we're going to specify that on the instructions. So take 4 tablets, PO or orally, 30 to 60 minutes prior to dental appointment. And because this is just a one-time use, it's only for antibiotic prophylaxis before the extraction, there's no need for repeats. So it's going to be 0 times. So this is what the prescription is going to look like, and this is how you're going to fill it out. I hope you found this helpful.